Gather equipment needed. Check that all equipment is functioning normally. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how he or she can cooperate. Good morning, ma'am. So I'm General Nolong, and I will be your nurse for today, and I'm gonna take your vital sign. Is it okay for you?
Yes.
I already washed my hand before entered to the room and provide for client privacy. So first, I'm gonna take your temperature. Place the client in the appropriate position. Move the gown to expose the cilia. Clean the thermometer using cotton ball with alcohol starting from bulb to stem using firm twisting motion.
Mali naman po.
Ma'am, can you please raise your arm? Wipe the axilla of the patient using paper towel in order to dry it without using friction. Press the button. Place the bulb of the thermometer into the center of the axilla. Bring the patient's arm down close to his body and place his forearm over his chest. Remove the thermometer when you hear a beeping sound. It means that the final reading is done. Remove the thermometer. Clean the thermometer with dry cotton ball from stem to bulb with one stroke only. Read the thermometer. Press the button. Clean the thermometer using cotton ball with alcohol starting from the stem to bulb. Using firm twisting motion, discard the cotton balls. And wash hands. Document the temperature in the client record. So the next is I'm gonna assess the respiratory rate of the client. I already checked the equipment and they are functioning well. So mom, I'm finished with your body temperature. I'm going to assess your respiratory rate. So the client's awareness of respiratory assessment. Place the client arm across his or her chest. Observe the patient's respiration. Can you please inhale? Exhale. Inhale. Exhale. Inhale. Exhale. So, ma'am, please continue your breathing. So, I'm gonna assess that in 1 minute. Rise and the fall of the patient's chest, which each is inspiration and expiration. Count for the required 1 full minute. Observe the depth, rhythm, and character of respirations. So now, ma'am, we're all done. You can now lay your hands down. And after that, document the breathing characteristics, rate, and rhythm. Check respiratory. And after that, I'm gonna assess the blood pressure of the client. So next time, I'm gonna take your blood pressure. Have the client assume a comfortable lying or sitting position with the forearm supported at the level of the heart and the palm of the hand upward. Select appropriate arm for the application of cuff. No intravenous infusion, breast or axilla surgery on that side. Cast, arteriovenous, shunt, or injured or diseased limb. Expose the area of brachial artery by removing garments or move the sleeve up. Place the lower edge of the bladder cuff 1 inch or 2.5 cm above the antecubital space. Wrap the cuff around the client's arm properly. Check the gauge. It must be within the zero area. Palpate the brachial or the radial pulse by pressing gently with the fingertips. Tighten the screw bulb on the bulb. Inflate the bladder cuff while palpating the artery. Note the point on the gauge where the pulse disappears. Deflate the cuff and wait for 1 to 2 minutes. And clean the earpiece and the bell using cotton ball with alcohol. Place the stethoscope earpiece at the ear properly. Place the bell of the stethoscope over the brachial artery. Hold the diaphragm with the thumb and index finger. Inflate the cuff 30 mm per mercury above the point at which the pulse disappeared. Release the valve and allow the gauge to drop 2 to 3 mm per mercury per second. Listen to the Korotkov sounds while releasing the valve. Note the first faint but clear sound, systolic, and the point at which the sound disappears, or diastolic. Read the pressure closest to the number. Allow the remaining air to escape quickly and completely. Wait for 2 minutes if you want to recheck the BP reading. Remove the cuff, clean and store the equipment, wash your hands.
Alagay mo muna. Sige. Kita pa rin ba ako? Please, nakontrol sa inyo. Paano lumaking sa princess? Balik pa na tayo. Ano sabi mo, princess? Hindi ko tao po eh. Kasi naman mo kanina ba? Sige. Magandang hapon po. Parang umabos ko. Magandang hapon po. Umabos ko po. Sabi ko sa patawa.
And after that, record the blood pressure. All the vital signs of the client is normal. Thank you for watching.